Happy Advocacy Day, everyone. My name is Eric Mathis. Today's topic is all about dealing with crisis and how we can help individuals and families. Just a few reminders today. Please use the Q&As box and any questions you have today. It can be found in the more menu depending on how you are accessing Zoom. We would prefer you only use the chat today for only the important links and for those that need accessibility reasons. We again prefer you use the Q&A for questions, and we encourage you to avoid long discussions in the chat because they can be distracting. We also need you to click on the globe icon today in Zoom and select if you want to hear today's program in English or Spanish, as this will help with our introduction services. Excuse me. And
Excuse you.
then lastly, we want to encourage all of our speakers today to speak slower so there are inter excuse excuse me
Excuse you.
the services correctly relays your words. With that, I will pass it to my two co-MCs today to introduce themselves, starting with Sean.
Uh,
Good morning, everyone. I am Sean Latham from Self Advocates in Leadership, and my visual description is I'm a white middle aged man with a brown sweater on. I have a picture of the SAIL logo and SAIL members in the background, and I will pass it to Emily.
Good morning. My name's Emily Rogers. I'm the Director of Public Policy for the DD Council, and my visual description is a middle-aged lady with gray ing hair and a blurred background. We're glad to have you here today and look forward to a great day. So I don't know if is Representative Callan here yet or
She is
Representative
here.
Callan just entered. Yeah.
oh awesome. Okay. Um so first of all I wanted to introduce Representative Callan from District 5, and I think that she has some remarks.
Oh, Representative Callan, we don't hear you.
I wasn't hearing you either, so I was trying to figure out, can you hear me
Oh,
now?
there we go.
Go.
Perfect. There's something definitely not
Thank
wrong here.
you.
Yeah, thank you.
Well, welcome and welcome to the group.
Welcome.
Well, thank you. Thank you for having me, for sure. Apologies for coming in a couple minutes late here. Um, the I just, let me first and foremost say thank you for being such tremendous advocates and making sure that, we're keeping in Olympia top priorities and hearing from you what we need to hear, especially in budget cut times, to not not hurt and create further harm for the IDD community in any way. This is our budget scenarios this year are really tough and really hard, and there'll be cuts. And the last thing we need to do is go backwards on where we are today. And we absolutely, even in the toughest of times, have to find a way to move forward. and further supports in what we look at and do. Your legislative agenda is right focused on all of that and really really key to making sure we're doing that. Of course, there's big price tags a lot with all all of the items, which is making it very difficult. But from my perspective, if we get policy in place, even if it's not funded, that builds the framework for when we can bring in money. If we're looking at additional revenue coming in, we should try to figure out a way to target some of that money towards these specific issues and how we relate to that. So those are all the things that I'm trying to do in the hallways and with my colleagues as we're working through budgets and trying to address some of that. Certainly, I didn't really introduce myself at all. Do I need to do that, or does anybody need to know
Go
kind of
ahead.
what committees I'm on? And maybe
Yeah,
I should.
please do that.
Okay. Yeah, I apologize. I just kind of jumped right into it. So Lisa Callan, I represent the 5th Legislative District, which starts in Issaquah and goes to the top of Snoqualmie Pass, and is just above I-90. So I get parts of the Snoqualmie Valley, and then I go all the way down, excuse me, through Enumclaw. So I have East King County and Southeast King County, a lot of the unincorporated areas and smaller communities, and then right on the edge of the density area with Issaquah. And then I serve on the K-12 Education K-12 Committee, and I serve on appropriations, and I serve as Vice Chair of Capital Budget for the House. And I have been also on the Human Services Early Learning Committee, and because I joined APROPS, I'm kind of bouncing between K-12 and Human Services Early Learning, where a lot of the IDD, bill policies are coming through in that space. And so still sending a lot of bills their way and trying to figure out how to work through the budget asks and trying to drive some of that and support your recommendations when they come to APROPS. So we have, allies and friends in the Appropriations Committee that can really support you as well as in the capital budget. Certainly on the capital budget, we'll be advocating for increased capital funding for housing and making sure we've got residential homes that we can put in place and increasing that. We've been dialing it up ever since I've been in office, and I'm hoping we can sustain and maintain, if not dial it up a pinch, depending on the demand and all of that work. So that's kind of capital budget land for me. And then also making sure that in our behavioral health space, when we have co-occurring work that's happening, co-occurring diagnoses and that type of stuff, that we have the facilities that can be responsive to providing the needs in community that we need. There's conversations, right, about RHCs and closures and what we do there. And if we don't have the facilities out there that can actually find a solid pathway, right, for moving our residents that are in RHCs and getting them into a much better living condition and the supports that they need, then there's all these barriers, right, to making that come to a fruition. So we have to really sync our operating dollars with our capital dollars and making sure that capital focus is there at the same time. And so those are also my capital focus areas in this space. And then this year in particular, I'm sorry, is there a couple questions or?
No, go ahead.
Okay. So the budget landscape, let me just kind of start there as a very basic kind of scenario of the state of affairs. And tell me if I'm repeating anything or something you're going to have later on in your agenda, because I want to make sure we're capitalizing on what you need and sticking to your agenda. But the Governor Inslee's budget that he put out, had a robust increased revenue plan and what we were doing in the state. And then he had some cuts, right, to try to balance the budget. And the realism of what we're facing and seeing is that the revenue forecast that he had, or the revenue ideas that he had, was more optimistic than what we can actually likely get done in this legislative session and bring forward to the state of Washington. And any revenue that does come forward out of this legislative session to help bridge the deficit gap that we're seeing will likely be challenged and put on the ballot for the voters to approve. So there'll be a delay in the implementation of any dollars coming in. And so you can expect no new revenue dollars really supportive at the very earliest, 27 would be my guess. 2027. So we definitely have a very short term, the 26 fiscal year budget hole that still has to be addressed and tried to figure out. The no revenue scenario. So that's also what Governor Inslee had to put out, what was called the Book One. So statutorily, he has to put out how to balance the budget if there's no additional revenue coming in on top of what is already existing in statute. Was a $15 billion cut, which was, you can imagine where we land on that space in Washington state and how much harm and hurt that's going to do across our state. So realistically, I think the two chambers, the Senate and the House, are going to have to try to find some place between Governor Inslee's Book One, which was really going to be the high water mark of two, and the Book One, which was the lowest, mark, and try to get somewhere in between, which means there'll be more cuts than what Inslee's budget had. That was the one that was actually put out publicly, and less revenue. So those are the things that I'm working on trying to figure out how we're prioritizing, through appropriations and the support that we can give through the capital budget, try to balance all that out. So in that landscape, we are definitely, specifically when it comes to, intellectual disabilities and developmental disabilities, we are looking to maintain and preserve funding, making sure that those anything that's been in the budget that we're holding to is not cut. Any new funding coming in, we really have to understand and take a look at what is that, how is that going to stack up to any of the other new fundings? And ours, we're really getting down to some of those questions of, does this save lives? And, what is the quality of life and where does that go? I think, from my perspective, making sure that we are putting people first in those budget decisions, and remembering that every decision and every dollar spent is about a person at the other, at the other end of that budget decision. So we need to make sure we're putting all of that forward. So, and I see the comment about the federally matched programs. I mean, that's also a very huge concern of the state, right? When we lose federal dollars, and even when we had the momentary freeze on dollars, the impacts to our state and what that looked like was huge. And so if we have our own state deficit and we lose the type of federal funding that we receive in our state, there's no way to backfill the federal gap, right? There's not enough state dollars to do it. And so then we're really into this mode where we really have to defend and protect those that need those dollars the most. And I think you have a lot of allies in this space, right, that need to speak up and make sure we're defending, and you bringing to the table when you're starting to hear what the depth of the cuts are, what that might look like. I mean, especially as we learn more about the federal government's potential loss of revenue. We can't respond on the daily executive order kind of response because, those are very fluid and dynamic. But we will respond to what we do know, by the end of session, and when we're in those last few weeks of real hard budget negotiations, and trying to make sure that we are stabilizing whatever impact and harm did come our way, and making sure we're trying to keep, again, the basic floor of services, and we're not losing that to the best that we can. And then on top of that, look at what additional support we can do that is really integrated or leveraging different funding sources in different ways. And so we're maximizing every additional dollar coming into the state in these directions. So, yeah, I mean, I think the theme of crisis is very appropriate, right? It's not, I mean, even if we weren't in a budget deficit, the IDD and DD community is in a crisis in terms of how they're supported and being funded, and you have been all along in terms of the revenue coming in. And when you add this other layer on top of it, there's nothing but, gloom and doom in our future. And so I feel that, and I know you're feeling that, and your concern and worry. And I know a lot of us in Olympia are losing sleep trying to figure out what we can best do in that space. And your voices coming through on, what is the priority and what is most critical and what is the harm and the impacts and the implications of any specific action that the legislature takes or the loss of federal funding is exactly what every legislator needs to hear so that they can lobby in support of, holding, preserving, and making sure that we can recognize that our budgets need to ensure that we're not losing any ground specifically for our Washingtonians that need us the most. So um, I've got a couple of bills myself that are in this space that, like I have the extending the complex needs, kids in crisis in hospitals, stuck in hospitals. That's work that is working with those children that actually are truly stuck in the hospital at the moment, can't get a discharge safely, but are also it's building the pathway for us to change our system so that we're preventing that from happening in the first place. And so that work that's multi-state agency and all of that, we need to do more. It was slow starting. It's barely been up a year with the coordinator hire, and so we need to keep doing that work. It has a fiscal note of $6 million, which in the size of the overall budget is not a big fiscal note. But at this point in time, I'm having a hard time getting it a hearing in approps because of that level of, and I've already negotiated, like cutting that down, to 3 million. Part of that is flexible funding to make sure that, I've got my 2-minute warning that I'm supposed to be on the floor, is flexible funding to spend to, really help support whatever services are necessary and needed for these children. And so that's just one example, right, of the conversations and the battle of how do we make sure that we are continuing this work that is so important for us to be able to change our system, but also making sure that we're taking care of the immediate needs that our children have today. And that's exactly the same is absolutely true for our adults that are in the same situation and in our long-term facilities, and for our staff and for our trained, all of the workforce that is connected to supporting them, providing the services and the shortages that we have there in every direction. So know that it feels like gloom and doom and there's a lot of worry, but also know and find hope in, because that's where I am, is trying to find the hope in that you have allies in this space that are very passionate and very worried and concerned and will um, fight for what the intellectual development and DD community need to have a quality of life and sustain, and to then try to grab some land that builds framework, even if we don't have the dollars, that will allow us to invest as soon as they do, and then continue working on building in revenue sources to help build that out. Yeah, so I'll just stop for a couple minutes. I know I'm going to be a little bit late to the floor, but is there anything that I missed? Is there anything you wish for me to cover? I don't want to leave with dread. I want you to have hope that your voice matters, and it matters more now than ever, because what you say and what the priorities are that you're bringing to the table is what we will hear last in our minds when budget cuts are happening, and we will keep foremost in our minds as we're trying to understand that. And that's going to make the difference. So your actions and your work is key to all of this, and you are who I'm listening to.
We appreciate that.
I did put a question in the box.
What's your question, Kyle?
It's just basically, what is your stance on closing the two institutions that were proposed in this year's deal by Representative Ormsby, Yakima Valley and Rainier School, and to save some money, because it will save money and help make sure people get in the community instead? Because I know that right now it's sitting in one of the committees that you're serving on through the Early Learning and DD Services Committee, and it hasn't waiting for a hearing. Do you know when it's going to have that hearing? Because I know Representative Burkhart is the chair.
Yeah, I don't know. I don't know when that hearing is going to happen. I know all of the hearings need to happen either by the end of this week or really in the first committee hearing of next week, because after that, anything that's going to be moved out of a committee from a policy perspective has to actually be voted on and voted out of committee by a week from Friday, because that's policy cutoff. So if it has a policy implication and it went to a policy committee, in order for the bill to move forward, it has to be voted out of committee, which means it has to have a hearing and then an executive session to vote by Friday. Yeah, so I think that's if it went straight to appropriations, then there's another week before we hit the fiscal cutoff in those decisions in the bill stay alive. Yeah.
As far as I know, neither bill has not, the bill that's in that particular has not moved forward. It's still waiting
Okay.
for a hearing at this point, and it's a policy,
Okay.
and I believe there's a fiscal note attached to it.
Yeah. Okay, so yeah, I don't know any further status on that. So I wish but I'll be watching it, and if it hits approps, then there's something I can connect in on that side. So I do have to run. Erica's told me that I've got another meeting. I got a conversation I got to have before I get to the floor. So thank you all
Thank
again
you
so
so
much,
much.
and really appreciate you. And however I can fill your buckets in this work, please let me know.
Have a good day and thank you.
Thank you.
Have a good
Thank
day,
you.
Lisa. Thank
Thank
you.
you.
Uh,
Thank
Thank you,
you.
Lisa.
Thank you.
So next on the agenda, we have Kathy Marahashi to talk about the intro to the topic. Although I think we got a pretty good intro already, but awesome. Thanks, Kathy.
Great. Let's hold on. I'm sharing my screen. I'll be really quick here. Let's see. Did it go?
Yes, I see
Can
welcome.
you see do you see the welcome screen? Okay, hold on. Let me move my slide along. So today's topic is, as you know, is crisis, and why are so many people in crisis? Um, oops, see if it doesn't want to move along. Sorry. There we go. This won't be surprising to any of you, but our systems aren't designed to accommodate the needs of people with IDD, particularly those that have unique physical challenges or experience challenges in being able to express their needs. We know there are few providers that have experience in training to support the needs of our population. And when we don't design and resource for equal access and opportunity, we know people end up in crisis. They end up in emergency rooms, jails, or other inappropriate facilities. So we need to make sure that we have investment in training and planning so people can receive the proper support to be able to live in the community. So, see. So what do we need? An adequate network of workers. Again, well-trained, well-paid. We need it to be robust. It needs to be across all our systems. Let's see, my next slide will pop. In our medical settings, in behavioral health settings, we need therapists. We need direct support workers. We need educators. We need them all to be trained and well paid and have adequate experiences, because we all know we have had that experience of talking to somebody that doesn't get our stuff and doesn't understand what is needed and how to well serve us. So what do we need? We need training. We need investment. We need planning for our folks, and we need the support that's needed. Those are simple things. That's just kind of a big picture, but that's a lot of stuff that needs to happen, right? And we haven't made those investments over the course of time, and we need a lot more. of all those things. So with that, I will stop sharing my screen. Let's see, where is my, okay, let's stop share.
I would like to introduce another speaker, Katrina Davis and Joy Gurner, and talking about why crisis is so important.
Joy, you want to start?
Sure. Hey, can y'all hear me?
Yeah.
Excellent. Good morning, everyone. Thank you for giving us a chance
Good morning, Joy.
to talk today. Hi. Katrina and I are going to tag team on this, like we tag team at work also a lot of times. So I'm going to start by introducing my role and myself briefly. My name's Joy Gaynor. I work at Seattle Children's Autism Center as a family advocate and case manager on our family resources team. So what I do is help the families who come to our center understand and access the resources that they need for their child and their family. So that includes navigating agencies and systems like the Developmental Disability Administration, special education, Medicaid are three of the big ones, especially for behavioral health needs, and also finding things like parent and caregiver support and connection, recreation and social opportunities for their kids and their family, and various financial supports. And then personally, I hold a master's in public policy, and I am the parent and guardian of my own beautiful young adult with profound autism. Her name is Audrey. She is 26 years old now. She requires around-the-clock supervision and a really high level of support to engage in the community and all of her preferred activities like swimming and going out for pizza. And that's me. So I'll hand it off to Katrina to introduce herself.
Good afternoon, everyone. Katrina Davis, and I'm a family advocate case resource manager at Seattle Children's, specifically in the emergency department, serving this population we're talking about today. Those who are in cycling crisis end up in the emergency department, often stuck there. So I am going to talk more about that today than my other job, which is the University of Washington, doing a program called the Washington Include Collaborative, which is doing all those autism echoes you might be hearing about across the state, autism and IDD. It's important to note that part of my lived experience and why I'm here today is also representing the needs of my own son, who is very high needs young man, profoundly impacted, high needs, and has been through this cycling crisis, very intense, traumatizing for families, and more importantly, the individual going through it. So I'm hoping to provide that perspective today, both those I serve that are in cycling crisis and my own family experience. Okay, I'm going to turn it back to Joy to talk more about, from her role and her perspective, why we're seeing this cycle of crisis happening.
Thanks, Kat. Love your nails, by the way.
Hi,
All right.
Joyce. I think you are twins. Joy 1 and Joy 2. I think you're twins. But my name is Antonio. My name is Antonio, and I respect to the people in Seattle Children's Hospital having appointments. And I think I'm not having appointments in Seattle Children's Hospital like 17 years, 18 years by the pandemic, 19 years, and now 20 years in the Seattle Children's Hospital, but I went to Harborview Hospital for Adults.
Mm-hmm.
So I'm already 22.
Yeah. That's a pretty common trajectory from Seattle Children's onto Harborview for care. Okay, so in my role at Seattle Children's Autism Center, because it's the Seattle Children's, to Antonio's point, sort of, I work with parents and caregivers who are navigating services on behalf of their child for the most part. I support families across the full spectrum of support needs for autism. I work with families who are in or on the verge of crisis pretty much every day. And what I mean when I say that is people who are caring for loved ones whose support needs, through no fault of their own, through no fault of the family, are just exhausting their ability to really continue and provide the level of care that they need. Or maybe whose externalizing behaviors are causing daily stress or harm to themselves or to others around them. Now, often when I see families who are in or who are moving towards crisis, the systems of care that are responsible for supporting them are not fulfilling their promise. So services are lacking or absent that we would hope would actually be in place for them. So what this means, for example, and I'm going to list some examples from different areas of support. Please know that when I'm talking about some failures of these systems, I am not talking about the many amazing people who work in these systems and agencies that I collaborate with every day. There are wonderful people working in these systems, but the systems themselves are not always providing the types of support that we might hope for. So for families getting services from the Developmental Disabilities Administration, or DDA, for example, it is often hard to understand and navigate the DDA services that might be available to them. I can even say this for myself with 20 years of experience supporting my daughter's DDA journey, that I still have trouble understanding what she can access and how to get that for her. DDA case managers have differing levels of experience and knowledge themselves, and they often have really high caseloads that can make it hard for them to offer proactive help to families who might need it, especially as they're in crisis or approaching crisis, and having trouble understanding, even knowing what they could ask for. It can also be hard at DDA to access really key services like personal care or respite. Families are expected to find the providers for these services themselves. Many struggle to do so. And the common barriers that I see are when, for example, the number of hours allotted is considered too low by potential providers who therefore are not willing to work with that child, or especially when a child's support needs or behaviors are deemed too challenging by the provider so that the family can't find providers who are willing to take them on. So what that means is that services might exist in theory on paper through DDA, but in reality, there are many families who are not able to really access them. And in many cases, that's particularly true for those clients who most need those services. Okay, that's DDA. When it comes to special education, for families who are, again, in or nearing crisis, I often see situations where children and youth are being sent home early or suspended from school, either officially or unofficially, where their parents are just being called over and over to pick up their child, and have to work to help families understand their rights under the Individuals with Disabilities Education Act. Many times the functional behavior assessments or behavior intervention plans that should by law be in place either don't exist or clearly are not working and need modifying. And there too, I often have to help families understand their right to have those in place or functioning properly. And of course, many districts are getting this right, I'm sure, but the situations I see are the not infrequent situations where families already under huge stress are having to advocate really strongly to get their child's basic legal rights at school. And that just contributes even further to their crisis situation. And then last but not least, a number of barriers exist for families who are seeking behavioral health services of all kinds, including ABA, especially for our Medicaid families. So a few examples there. It's very difficult to find providers for medication management for our families, both in primary care and in psychiatry. And the more complex the need, for example, when there's co-occurring conditions or particularly challenging behaviors, the harder it is to find a provider to manage medications. For many of our families in crisis, the issues are behavioral, and ABA is the recommended therapy model. And there's a significant shortage of available ABA providers, with families commonly having long wait times before they can access services. The older the child, the more challenging the behaviors that we're trying to help with, the harder it becomes to find a provider. And it can verge on impossible in some areas of our state, where there's a virtual desert of ABA providers. And then autism is often a rule out for more intensive programs that serve youth with other mental health concerns like depression or anxiety or other conditions, no matter how their autism expresses. So even if it's not accompanied by intellectual disability or significant communication or language impairments, that existence of autism may be a rule out that means they can't access behavioral health services that could otherwise support. That was a quick summary of the barriers and dysfunctions that I see in these different systems. I see them every single day. They're not rare. I see them overwhelming families who have too much on their plates to cope with these added burdens. And when I say too much, I mean everyday things that we all have, like jobs, other children, aging parents, in addition to their loved one with these extra needs that they are seeking to support. And I see these barriers affecting families who are savvy advocates and know the system well as families who don't have those inherent advantages or haven't yet developed those skills. It can bring all of us underwater pretty quickly when the crisis hits. And like Katrina mentioned, I have personal experience with that too. And then overall and over time, the higher the impact of a child's autism on a child and their family, the greater the burden of this broken navigation and the greater the burden of these barriers in the system. And I'm going to hand it off to Katrina.
Okay. Kathy, how are we doing for time? I'm going to stay focused here. It's 10:38. When do you want me to be done? How many minutes?
You have a couple of minutes.
Okay.
So I think we're okay.
Joy covered a lot of what I was going to cover, so I'm going to cut this down. So in my role at Children's in the emergency department, and Children's hired this position, and other hospitals are really moving towards that because of the wave of DDA enrolled or DDA eligible, or this more profoundly impacted population is in cycling unethical crisis. And it really is unethical when you look at some of the outcomes happening because of this stuck in the hospital situation, which our ombuds, DD ombuds, has done a great job tracking and proposing solutions. So they're going into crisis. A lot of times it's behavioral or mental health, but the population I serve who are profound, and I know there's I'm sorry, I wish we had more words, but profound, level 3, high needs, high support needs, however we want to call it, the population that has, as Kathy said, a difficult time expressing their needs and their wants and how they're feeling. And what that results in is a lot of times they're using behavior as communication. And the answer isn't as easy as ABA or putting a keyboard in front of them. These people have profound disabilities that make it hard. So they're telling us how they feel. And that can result in aggression in the form of, harmful towards themselves and others, physical harm, property destruction, bolting from the family home into unsafe areas, all kinds of really alarming, difficult lived experiences. So when we talk about this population, we're talking about those who have intellectual impairment, who struggle with ability to communicate and not to be confused by those people who can communicate. Maybe they're not verbal, but they can communicate. These are folks that have really challenging, expressive and receptive challenges. And they experience challenging behaviors a lot of the time. And that's the population we're seeing at Children's and other hospitals. And they're stuck because the services that exist that would have prevented that crisis through DDA, through Medicaid, through schools, and just through the natural supports in life, they exist, folks, right? We have respite, we have caregivers, we have specialized rehabilitation, we have supported living, we have supported employment, we have OT, speech therapist, ABA, crisis services, inpatient, blah, blah, blah. But guess what? Those services they're almost impossible or non-existent, impossible to access or non-existent for this population. And it is really like systematic discrimination against a group that is being marginalized even more than they already are. And what that results in is families, isolation, exclusion from just what other people have access to. And by the way, I'm not saying the problems of this population are more important, because I know all those services I just listed are hard to get for a lot of people enrolled in those systems. What I'm saying is, what we're seeing is almost impossible to get for this population. And that feels exclusionary, and it feels like discrimination. So it results in despair, isolation, cycling crisis, and worst of all, out of home or out of state placement, more often out of state, because this is a population we don't have residential therapeutic settings, except Lake Burien now. And luckily that's getting off the ground. But so I'm not going to list, but all those services that would have prevented the crisis, they're hard to get. Then when they're in crisis, we don't have services for this population when they're in active crisis. Medication management, in the home intensive, long-term intensive supports, not just 2 hours a day. We're talking almost full time, because if someone's needs exceeds what the parents can provide safely in the family home, they end up in the hospital. This also applies to our DDA residential facilities. A lot of the DDA residential contracted agencies are having a hard time serving this population, and they end up in the ED too. And they're not released back to that supported living agency. They're stuck in the hospital. So I appreciate that we're talking about this stuck in the hospital group of people. I love that we have 1580, the Hospitalized Children's Program. It's sad to hear that that might be in jeopardy because 1580 has really done some creative solutions. They have slush money. I don't know what we call it. They have flexible funds that allows us to do, and I've seen it work miracles to actually find those services or build them. Because again, we can't just use what exists because this population can't access it. Okay, the reason why I'll say that the reason why I think a lot of this population is suffering, and all of them are, is that, but the contracted providers for DDA, for Medicaid, for even school districts, their skill, expertise, and comfort level, they just don't have that for this population. They're not mandated to serve this population. They're not paid more, and they're not incentivized, so they don't. I'm going to end with more, now more than ever, and I hate that we always say that, but really now more than ever, it's important that we align, that we seek to understand the differing needs, acknowledge them, work together to align. There's triggering words, there's triggering situations, and we all feel it. I know a lot of self-advocates do. I know a lot of people in the IDD advocacy world do, but I hope we can find common ground and seek to understand and acknowledge the different lived experiences and work together to really address this unique problem, because it may require different services and supports than what are being proposed right now for this population. Thank you very much. And I think there was something in the chat I might have forgot to say, but thanks for saying that, Joy. And thanks to just all of you advocates, self-advocates, professional advocates, and all the people from systems of care here today. I see how hard you all work and how much you care. Thank you.
Thank you both for speaking. That is important, and that's great. Our next speaker is one of my coworkers, Sandra from the Arca King County. Will be talking about families in crisis.
Thank you so much, Eric. Good morning, everyone. Thank you for having me. Can you hear me well?
Yes.
Okay, thank you. So my name is Sandra Urite. My pronouns are she, her. My visual description is I'm a white woman in my 50s. My hair is dark brown. I'm wearing it on a ponytail. I'm also wearing glasses and a bluish, knit sweater. I work at the Arc of King County. I'm the Multicultural Family Support Program Manager, serving Spanish-speaking people with intellectual and developmental disabilities and their families. I'm also a parent of a 21 years old daughter, and I have a 19 years old son. My daughter, Caroline, she was diagnosed with Cri-du-Chat syndrome when she was around 6 months old. She's nonverbal, and she has some highly challenging behaviors. The reason I'm here today is to share with all of you my I would say my personal experience, but also what a lot of families of adults with developmental disabilities are facing when their loved ones start this transition from the pediatric, medical and dental care services to the adult system. I think it was around probably 6 months before my daughter turning 21 when I began looking, for adult medical and dental providers who were, accepting Medicaid. And also, I would say I was not looking for like experts, but at least providers with some kind of experiences, serving people with developmental disabilities. And because of my work at the ARC, I was aware that it was difficult for families, to find providers for their adults, son or daughters. But I really never believed the problem was so serious until it, touched me directly when it was really the time to, start to do this searching and looking for providers. I would say that my personal experience and I, hear this from families all the time. Here in Washington State, accessing a dental care, a dentist, finding a dentist for adults with developmental disabilities is absolutely difficult, very challenging. Most of the time is like what we see is that limited dental providers. So specific, we don't have, I would say, a well-trained dentist that can treat, people with disabilities. We have also seen that in people with developmental disabilities usually have a greater need for sedation when they are, trying to get a dental treatment. And sometimes because of their disabilities, their ability to cooperate with the treatment is a little bit more challenging. So when we face that most of the dentists are lacking, the preparation, the education, the techniques to be able to provide services, to use some kind of behavior management techniques to be able to treat people with disabilities. That's one of the biggest reasons for what is so difficult sometimes to find a provider. Also, I think some dental offices are not able to provide the accommodations, to serve people with intellectual developmental disabilities, but also physical disabilities. And plus, you have to add another barrier that is many dentists are not accepting Medicaid, especially because of the low reimbursement rates. So, this is more limited for families to find a provider because, as I said, if the person with disabilities has Medicaid, it's very, very difficult finding a dental provider that accepts Medicaid. And the other thing is sometimes when you found a provider, the wait time to get access to an appointment is really more longer than usual. Adult with disabilities also, I would say that in this state has a few places where they can receive the kind of treatment and services they need. Probably most of you maybe have heard the University of Washington School of Dentistry is one of the few ones that is available. But the last time I checked, they have a waiting time of around 15 months. So we're talking about more than a year to have the opportunity to, have an appointment. So it's really difficult, put families, under such a stress because they know they need to, be sure that their son, their daughter are accessing the care, but you look around and there's no providers, or there's some providers that are not really trained or are not accepting Medicaid. So families end, saying, okay, what else can I do? And unfortunately, until now, there is really no solution. And we know that providing dental care for adults with developmental disabilities could be highly cost, but at the same time, we know that in the long term is more effective because there are some preventable oral health conditions that, could lead to more serious health conditions in the future. Personally, I'm still looking for a provider for my daughter. We were really fortunate in my daughter had a dentist for many years, a pediatric dentist, and he was awesome. He was really open to work with her and accommodating her. But he retires, and now, unfortunately, I'm not able to find a provider for her. And I receive calls working at the ARC from families all the time, exactly, looking for the same. They want to find dentists that can provide services and treatment for a person with disabilities. And I would say that the same issue is for families that also are looking for medical, just a medical professional. Usually, when they're people with disabilities is under 18, you have Seattle Children's, you have Mary Bridge, and they can access services, they can access the specialties, and those professionals have the knowledge and the experience working with people with disabilities. But once the person turns 21 or 18, depending on the kind of provider, finding this type of care becomes almost impossible. There are not enough available, primary care physicians or other providers that feel educated or comfortable, caring for individuals with developmental disabilities. I'm aware, and I'm also, my daughter is a patient at the Multicare Adult Developmental Clinic. That is, I think, probably the only one in this area that provide like a multi-specialty support for adults with developmental disabilities. But this clinic was created by an initiative from some doctors that, are aware that there is a lack of services for adults. And they are really working because they are passionate and they are trying to, support the families because they know that is really a need. But right now, for example, the clinic is able to serve only 2 days per month for 3.5 hours. So imagine that it's not enough for the number of people that are really waiting to get services.
Sandra?
Yes.
Yes. I think our next speaker is here.
Yeah. Yes.
Do you want to finish the close up?
Yeah, I was just going to say that I think it's crucial, to prepare the systems and professionals to meet, this growing demand and finding, the resources to get more providers for adults with developmental disabilities. And that's all. Thank you so much.
Thank you.
Good morning, everyone. Again, my name is Sean Latham from Lacey and Self Advocates in Leadership. So I'm not Priscilla Wong. She is much prettier than me. We had a scheduling issue, so I'm going to fill in for her right now. And on March 5th, you will hear her for that Advocacy Day. We all have experienced crisis, some big, some small. I remember being in college back in the day and waiting for my caregiver to show up so I could take care of my personal needs. but having issues with them canceling right before, which meant often my nighttime caregiver and friend, who was also in school, had to stop what they were doing and help me. I had other incidents where, due to scheduling issues, caregivers took off before helping me in the restroom or fixing me lunch. I learned at that point scheduling is very important, but also making sure I hired the right providers was critical. I also learned how to do things on my own, not very well sometimes, and it took a long time sometimes, but in a way those experiences helped me to be more independent. I would consider these smaller crises, but let's talk about other types of crises that are more jarring. I had a friend one time left in bed for over a day in Ellensburg because their provider did not show up. That is a crisis. I had another person that, due to staffing shortages at an agency, had to sleep in his wheelchair. That is a crisis. I had another friend who desperately needed help in his home, like I get, but due to his income after being retired, he made more money than Medicaid would allow, and so he could not qualify for home care services and had to rely on his even elderly family member to help. That is a crisis. I've heard from various people that had to wait for showers up to a week or more due to staffing shortages or not having the right equipment to transfer. That is a crisis. I had 3 friends who all died of bladder cancer within 5 years, partly due to medical tests not being accessible for those needing to be transferred, and so their cancer grew faster. That is a crisis. With each of these crises, it shows a few things. First, we need more high-quality providers, so we must increase provider wages, we must improve provider trainings, and we must make sure the process to become a provider is easier and faster. We must also work together to let our local leaders, our state officials and legislators, and federal Congress and executive branches know why the services and programs we use each and every day are necessary, not just for us to have a meaningful life, but just a life. Without many state and federal medical programs, we would be solely reliant on family. A lot of families are aging, and some people don't have families. If we as a country don't support people with disabilities, some will end up in hospitals or nursing homes, others will go to institutions, some will become homeless, and unfortunately some will die. I urge you today to advocate for your family and all families to get the necessary services and programs needed to improve their lives, save lives, and prevent crises. People deserve to be supported and have the proper supports to live an independent, fruitful life. Thank you.
Thank you, Sean. Our next speaker is Jamie Wilson.
Jamie, are you here?
I am here. Hi.
There, great. Good to see you. Thank you for being here.
It's so good to see you too. Thank you so much for having me. And I want to thank Sean for his comments and everything about the crisis that we're facing. And really, Sean is exactly right on the button. And everybody else that spoke before too, right on about the crises we're all facing, especially those of us with, different barriers to access. And this is one thing that I wanted to emphasize here is that, just to clarify, I am a prescribing psychologist and also a board certified neuropsychologist. And the focus of my work here in Tacoma is with the deaf and hard of hearing, deaf blind, and they deafened as well as those with intellectual developmental disabilities. So I do a lot of neuropsychological evaluations, and I also prescribe medications. But the state that I prescribe in is in Idaho. And part of the reason is because Washington State does not allow prescribing psychologists just yet. And I wanted to share with you a little story here, especially in light of the fact that tomorrow we have a hearing for Senate Bill 5112, SB 5112, and that is for prescribing psychologists. And the story that I wanted to share with you kind of emphasizes the need for prescribing psychologists. So what happened was a couple of years ago, I was doing a neuropsychological evaluation with a deaf individual, and I made a recommendation for medications. And the individual went looking for months and months and months and could not find a prescribing provider. They were not able to find a psychiatrist or a nurse practitioner or a physician assistant, a PA. They were not able to find anyone to prescribe their medication. And tragically, this deaf individual jumped off the Capitol Boulevard Bridge over by the state capitol in Olympia. Maybe you recognize that bridge when you're driving north towards Seattle. The road on I-5, it kind of curves around. And if you look out into the horizon, you can see the Capitol there. There's that big bridge there. That's the Capitol Boulevard Bridge. And so she jumped off that bridge and killed herself and her baby. And she had come to me asking for medications. And I was not able to prescribe the medications for her. Because I did not yet have the authority to do it. My hands were tied. And that kind of is what spurred me to pursue advanced medical training. I went back and pursued this advanced medical training for 5 years and got a controlled substance license to be able to prescribe in Idaho. And now I can prescribe to pediatric, adult, geriatric, individuals with intellectual developmental disabilities, deaf and hard of hearing, deaf blind, and I have learned to be able to prescribe medications and recognize drug-drug interactions and be able to monitor black box warnings and also work collaboratively with other medical professionals. And about 3 months ago, I was working with another deaf individual who had suicidal ideation, and I was able to provide therapy and medications. And this individual has done a complete 180-degree turnaround and is completely stabilized and is just thriving. And, that there is a stark contrast to what happened to the other deaf person that, she ended up jumping off the bridge. She couldn't get access to services. And with deaf and hard of hearing individuals, there are a lot, and it's very similar with individuals with developmental disabilities as well. There are a lot of syndromic presentations that can come up. And when we have syndromic presentations that come up, that means that we might have problems with the thyroid or issues with cardiac problems or maybe the lungs or renal, kidney issues or hepatic liver issues. So we can have different issues or with different organs of the body. And we have to know how to prescribe medications that don't metabolize or are not metabolized in that specific organ system if it's not fully functional. And so I have recognized that my training that I've received has prepared me well to be able to prescribe to these populations. And I'm also prescribing to individuals at the Idaho School for the Deaf and Blind. So we have a lot of individuals there that also have other plus developmental disabilities. And, I pursued extra preceptorship hours to be able to qualify to prescribe to pediatric populations. So I prescribe to young children, adolescents, adults, as well as the geriatric population. And this is needed because we all know there is a severe lack of access to appropriate providers for this specific population that we have that we're talking about today. And, I'm just grateful to be able to have the trust of my community in Idaho. And I really would like to see that happen here. And I'm hoping that each of you would take this opportunity and sign in support of the bill, because a lot of the legislators tomorrow, they're going to be looking at the numbers. And the opposition, the American Medical Association, they spend was over $4 million a year fighting scope of practice, scope creep. So they fight against nurse practitioners, they fight against PAs, they fight against optometrists, and it's not right. I think it's an ethics issue, because if you cannot provide access, what do? You need to provide a solution, and prescribing psychology is a solution. That can happen, not next year, not 3 years from now, but today it's a solution. We have a lot of prescribing psychologists right now here in Washington State. And this is the link to be able to sign in pro on the bill if you would like to do that and show your support for the bill. If anybody has any questions for me, I'd be happy to answer them. Thank you so much.
Thank you so much for the good information.
My name is Antonio. My name is Antonio. Nice to meet you, Sean. Well, for Medicare, it's for everyone. It's to be drinking the Medicare for the medicines to be nice, to drink it in the mornings, afternoons. People
And
to be nice.
I think we have another speaker that wants to get in with this crowd before we run out of time. So
I'll do it for that another day. Thank you, Emily.
thank you. I appreciate it. So next we have the supported living complex needs pilot with Scott Livengood.
Hi, Emily.
Hi.
Thanks, appreciate it. So I'll cover a little bit about supported living, especially the complex needs pilot that was started last year, and give you a little detail. I'm going to share my screen here. Okay, so I am Scott Livengood with Alpha Supported Living Services, and I also serve as one of the legislative co-chairs for CRSA. So for a number of years, we've been talking about the complexity of some of the individuals being served in supported living, and for over a decade have been talking to DDA about the need to have some sort of additional funding or additional training to serve these individuals. But it wasn't until the rate study came out that it included something in there about the fact that over 50% of the individuals served in supported living now have a accompanying mental health diagnosis and needed additional support, and recommended an add-on payment to support those individuals with higher trained and higher compensated employees. So one of the things that we've been seeing over the past decade is the change in the individuals who are being referred for supported living services, primarily saying over and over again that it is a crisis-driven situation, that only those who are in crisis and those with the highest needs are being referred out. And some of the data we received from DDA showed that. So what you're seeing on the screen is the tier levels that individuals are placed at, and that shows essentially the level of support they receive, the level of needs that they have. Without getting into a lot of the weeds, those at tiers 1 through 4 are individuals who don't need 24-hour support, who maybe are seen a few hours a day or maybe several times a week. And those, once you get to levels 5, 6, and 7, they receive 24/7 care, but they're often in shared housing and get some of the services shared across their housemates. Levels 8 and 9 are typically single-person households and often get 2-on-1 support on top of the 24/7 care. And so you've seen just in 8 years' time, all of the lower levels have seen significant decreases in the number of individuals served at those levels. And then you see 4, 5 times as many individuals being at the highest end of the tiers. So individuals being served in support living are more and more complex over the last 8 years. So from that data and also from the rate study, the complex needs was something that was funded by the legislature. It was a pilot program to serve 30 individuals with more extensive behavior supports. These are individuals who would be stuck in a hospital, at a mental health facility, out-of-state placement, an RHC. And there were 6 providers who took part in this complex needs pilot. They had to be an agency that has been around for a period of time with no enforcement actions and serving a higher number of individuals and having already some sort of physical intervention training for staff. And so DDA selected these and referrals started going out last January. And what was funded was on top of the assessed rate that providers would get, you would also get up to $450 additional per day. And that was to cover the additional training that was required, as well as to compensate the DSPs at a higher rate so that they could work with the individuals being referred. The agency also, part of that funding was to fund having a BCBA in your program, a board certified behavior analyst. And some of the additional training that was required included trauma-informed care, physical interventions, dual diagnosis core competency, client-specific training, and then some sort of professional certification. Most agencies went through NAD, the statewide organization that had a certification process. And by November 1st, all 30 individuals were successfully placed in support living across the 6 agencies. Our agency was part of that pilot, and we served 6 of the individuals. And these were individuals who came from out-of-state placements, Western state, RHCs, and some from stuck in the hospital. So with the higher funding, providers actually saw lower turnover, even though they were serving some more complex individuals. Turnover of the staff was higher, and we can say that relates to the additional training. They felt more prepared, having BCBA as a resource, and also being compensated higher. So there were some lessons learned. Not everything went perfectly. So we recommend going with a statewide credentialing rather than the national. There were some significant challenges with getting the staff through that to successfully pass the test. A lot of it was related to the open-ended questions rather than black and white questions that were asked. They were all scenario questions, as well as English as a second language. There were some challenges there. Not all the referrals were fully vetted by DDA. So even though they were referred out, perhaps they were not ready, not meaning they couldn't be served, but maybe the guardian was not on board with them being referred out, or some obstacles to placement, such as out of state, requiring providers needing to fly to that state to meet the individual and learn about their supports. Housing is always an issue. Finding affordable housing for people to move into. There was no capital funding that went along with this, so we were left to our own devices to find housing. And making sure funding is equitable across community residential and state operated settings would be another thing that would be important. And the last thing I want to point out is just, even though the individuals were served, there's still additional crisis resources that are needed. There are going to be times when some additional supports are needed, so funding additional crisis diversion beds would be something that's necessary to go forward if they are going to build upon this program. So that's a little bit about the program. Not sure if there's any questions.
Someone wondered if you would share the slides.
I can. That was a longer presentation to a legislative committee that I condensed down this morning, so I can definitely share that out.
Thank you, Scott.
Thank you, Scott.
Thank you. Appreciate it.
Thank you, Scott, for sharing with us about this program. And now it's my pleasure to turn it over to a friend in the ARC of King County, Director of Public Policy and Civic Engagement, Ramona Haddendorf. She will be speaking about a crisis program in King County.
Hi, everyone. let me get the slideshow started. Okay, I'm just going to do something real quickly. I'm going to let you know about a program that is a partnership of the YMCA, King County, and DDA, so the Developmental Disabilities Administration. And I would say this is a local coordinated response to trying to help people with developmental disabilities who are in a behavioral crisis. I don't know a lot of the details. I am the sharer of information. So if you have some specific questions, let me know and I'll reach out to somebody at the county maybe who can answer those questions. But this is a program that is designed for youth, so ages 2 to 20. They do need to be in King County. It's family. It's a family wraparound sort of model, and so it does need to be include a parent or a guardian. They need to live with a parent or guardian, and they have a diagnosed developmental disability. So it's a very specific group of folks. And then what does it do? For 90 days, which is 3 months, they get some services to help if they're in crisis. And these can include safety planning, a functional behavior assessment, a behavioral support plan, some parent coaching, some limited behavior intervention, education advocacy, and connection to community-based resources. So this is really more of a program to kind of get the floor, like, okay, let's see what's going on. Let's get some plans in place, and then we'll connect you to even more services. And the goal is to reduce hospitalization and emergency room visits. They want to help prevent really high-risk behaviors that can end up in crisis or safety situations. And they are, at the same time, they're trying to build community capacity to support children with intellectual or other developmental disabilities, as well as their parents and caregivers. So it really thinks of it in terms of a family situation, not just the individual situation. Those behavior supports are provided in home, and they also emphasize these are positive supports, and it's a type of functional assessment. It's called a positive functional assessment. And they already mentioned the supporting the family and the community resources. And some of the details is that you do need to have a developmental disability, but you do not have to be enrolled in the DDA. Where DDA comes in is if you are a DDA client, they will probably pay for it. They'll compensate for it, but they will take people. You do have to have a developmental disability, but you don't have to be a DDA client. And then also, so CORES, by the way, that was the what was it? Crisis Outreach Response System. So the Crisis Outreach Response System for DD includes an intervention specialist, the parent, and a behavior technician. So again, really zeroing in and trying to come up with some information and then a support plan. And then in 2023, this program served 43 children. It was a very diverse group of youth. Most of them were between 5 and 11 years old. So we're really looking at sort of that K5, K6 grade level. Most of them were male. The primary referral for so far in 2023 was the DDA. The average wait was 0 to a week. So some people in crisis are in crisis for months. So I thought that was very positive. And then it's the YMCA. They are the provider, and it's their Children's Crisis Outreach and Response System. And the types of support they did, everyone needed behavioral management. Everyone needed support with daily functioning. Most had some sort of aggressive behavior that they needed support with, and the behaviors were causing a danger to self or danger to others. Some of them, but not all of them, were in hospital situations. Some, but not all, had placement concerns. And usually by placement concerns, I think what they meant by that is possibly an out-of-home placement, possibly maybe the need for some sort of group home setting, but I'm not positive about that. So if you are in King County and you do have a developmental disability, There are two ways that you can access this. One is you would request it through your case resource manager. So you need to reach out and let them know that you wanted this service. And then they do a referral form. And then that referral form gets forwarded on to the YMCA team. And if you're not a DDA client, King County has a county crisis line. So you can call that county crisis line. And then they'll do an intake, and then you can actually request saying, I want this specific thing. And then they can refer, that intake service can refer you to where you need to go. So that is just really short in a nutshell. And I would say the takeaway are two things. If you are a person or a family member with a developmental disability in King County, I think it's important to know that something like this exists. If you're not in King County, I think it's something important to know that something like this can exist because it might help with your advocacy to help your county think about how they can partner. Like, could they also partner with a local community organization like the YMCA or somebody who's already providing these services? Since King County did it, there's been some information collected that might be able to help other people start up similar services. So that would be my two takeaways. And I hope you all have a really good day. I know this is a really heavy topic, but we'll just keep educating ourselves and letting people know what we need. And part of that is asking for more adaptive services like this one. Thanks.
Thank you, Mona, so much. I am now gonna.
Next, I will turn it back over to Kathy for today's look at the bills of interest.
Great. Thank you. I'm going to share my screen a bit. I'll try to do this quickly. We were running out of time, but I'll let you know that we'll stay after to answer questions if you have, but I'm going to kind of run through these quickly. So there's a lot happening this week. There's some hearings that are happening. Let's see, there was a hearing this week for the 1493, which lowers the age for employment on the waiver for employment and community inclusion. That happened yesterday. Let's see. The Community Protection Program, repealing that has come out of the executive session, which is great. I guess I should take one step back and say, we talk about cutoff, legislative cutoff. So by next Friday, the 21st, all the bills have to come out of their committee of origin. So that's like the Human Services Committee or the Early Learning Community or the Education Committee. They have to come out of those by the 21st. And if they don't, they're pretty much dead. And they can move over. They have to move over to the Fiscal Committee. If they're in the Fiscal Committee to start with, they're okay. But so some of the bills we talked about earlier, and one of them that we talked, somebody had asked about the Closing Yakima bill, 1472 and 5393. 1472, it's still in its origin committee, but 5393, we just learned, got moved to the Fiscal Committee. So that means it's not going to be dead without a hearing next week. So, it'll still need a hearing in the Fiscal Committee, but just so you know that moved forward. A bill that's come up more recently, and it has a hearing on Friday at 10:30. The 5680 is the right to repair for mobility equipment. That means you have a right to repair your own, wheelchair if you need to and get it fixed without having to wait for a company or certified folks. So that has a hearing again at Friday, which may be of interest to you. Let's see. So this is a bill that's concerning. 1908 just came up. And what it does is it keeps Yakimaville, all the RHCs open, and it kind of, one of them particularly has a legislation that says once Yakima reaches a certain size, it needs to close. This bill would take that away. So this is concerning. That's 1908. So you may want to let your legislators know how you feel about that. And it's come up rather quickly. Let's see some of these bills. The bill about IEPs having being able to be recorded had a hearing, so that's good. I'm gonna skip a couple of these. There's a bunch of education bills. A bunch of them have had hearings. I'm trying to see if any have hearings this week. The bill, there's an executive session for 5253, which extends school to age 22. That has an executive session, so hopefully that will bump it out of committee and we'll move forward. That is, let's see, that was yesterday, actually, excuse me. And let's see, this week has gone fast. There's a bunch. Tomorrow there is a hearing in Senate Early Learning on 5654, which is the restraint and isolation bill. As Ramona said, it's not a perfect bill, but it moves things forward. So that may be of interest to you. Let's see, I'm just going to go through some of these. There's some housing bills. The Paying Parents of Minors 1200 has an executive session this Friday at 8 a.m. And the Senate bill already had a hearing this week in, I believe, Ways and Means. So that bill will definitely move forward because it's already in Ways and Means. The 1344, the increasing access to respite by adding respite to basic plus waivers aggregate services. It has an executive session this Friday, so we're hoping that moves it out as well for negotiation over to the fiscal committee. I think the rare disease bills had a hearing this week, and hopefully that will move forward as well. There's a bill about ABLE accounts. It had a hearing yesterday. I don't know if it'll move forward into Ways and Means, but that's kind of the big picture. Like I said, it's a lot going on. A lot of these bills, not this week, but the next week will go away because they didn't get a hearing, and our list will shrink quite a bit. Also, the bill that Jamie talked about today around prescribing psychologists has a hearing tomorrow. I put that link in the chat box if you're interested in signing on there. Okay, I think I'm going to stop because we're kind of running out of time. So, and then, yeah, go ahead.
This is Sean. You'll learn today a lot about why people are in crisis. Due to time, I'm going to refer you to our one-pager for more information on the topic of crisis. I'm also going to share the 2025 Legislative Advocacy Tips video in the chat. If you want to see it, we can play it maybe after my closing remarks. We must today work to advocate for an adequate network of providers and therapists that are well paid. We must train providers on how to work with those with dual diagnosis. And we must make sure families are supported in and out of their home. We encourage this week to reach out to your legislators on each of these important topics. I will add again, it's very important to reach out to all of the new legislators, especially to educate them about our issues. Sharing your personal stories is one of the best ways for your legislators to get to know what you need. For more information about these and other issues you learned about today, I'm going to post this week's one-pager in the chat. Also, again, please see the ARC's bills of interests for additional information. Lastly, I want to encourage you to fill out our Advocacy Day survey. This helps us understand what you like and what you didn't like about Advocacy Day, so we can get better and better. You have the option of filling out the Zoom survey that you should see on the screen now, or alternatively, you can click on the links I posted in the chat. There will be an English and Spanish link. Let us know after if you need any assistance in filling out the survey. With that, I will end the main programs with the famous words, "Change is made by those who show up." Thank you.
Thank you, Sean. I just want to say one quick announcement. We've been talking, this was all about state issues. There's discussion about federal issues around Medicaid. And we are going to be asking for people to share their story about why Medicaid matters to them. I think we have a link to a form. Is that ready, Christy? Could we put that in the chat box that you can fill out and you can share stuff?
Yep, I'll get that added.
That's great. So if you have you can do a 30-second video or a minute video, or you can just share words that you want with your picture and send it to us, and that form will be there. So we'll continue to collect those throughout the session. So thank you. And please fill out the Zoom poll, please. It really helps us. And if you have other questions, we'll stick around for a few minutes for folks that have questions.